It seems as though it's like a blur, because I think this aftermath of the cleanup and looking at what I'm looking at now, which looks like what I'm told would be a war zone, because I've never experienced a war, I think I'm in survival mode.
Monday night was probably the most terrifying night of my life, hearing the transformers exploding and the car alarms dying, were just an incredibly eerie sound, and the smells coming in.
People need places to live. They need clothes. They need food. They need shelter. And you're gonna have these children going to school. How are they getting there? How are you getting these kids who are already in the shelters to the schools that they got to go to?
People's lives definitely disrupted. Recovery efforts are continuing in the Northeast due to the devastating effects of Hurricane Sandy. At this hour, over 2 million customers are still without power. 92 deaths have been caused by the storm, including 38 here in the city of New York. Damage is widespread, and the road to recovery could take a long time for many communities in the region. There's no doubt Hurricane Sandy has many people in need of assistance. They need water, food, and clothes, among other things. And there's a number of ways to help. You can visit FEMA.gov and click on Volunteer and Donate. There you can find ways to donate to specific states in need of help. You can also visit redcross.org and click on Donate Funds to give to any Red Cross chapter. Hurricane Sandy has also caused a blood shortage because of the blood drive cancellations. To find out where you can donate blood, visit redcrossblood.org. Meanwhile, the storm has forced 2 major New York City hospitals to evacuate. Backup generators failed at Bellevue Hospital and at NYU Langone Medical Center. Hundreds of patients had to evacuate, including patients in critical condition and 20 babies from the intensive care unit. Doctors described the evacuations as labor-intensive and extremely difficult. Joining me tonight is a hero, a nurse, Lori Touchette, one of the hero nurses who helped evacuate premature and sick babies when NYU's Langone Hospital lost power during Hurricane Sandy. Did you great to have you with us tonight, and congratulations on what you did. You've done your profession and your life proud in many, many ways. When this was all unfolding, did you have a sense that it was going to get as bad as it did?
We initially didn't. We had made many preparations to have our nursing staff as well as physicians on site in order to facilitate the most safe care, but we didn't have any idea the extent that the damage would cause.
What did you go through, Lori? What happened?
I work on a unit that takes care of babies who have had heart disease or heart surgery. It's a congenital cardiovascular care unit, and we had 7 babies who were critical patients who were not able to be removed from the hospital.
Did you think at any time that maybe some of them aren't going to make it?
There was never a point that I thought that. We were all very nervous and concerned for the safety of our patients, but I really am so proud of my NYU coworkers, the nurses, nurse practitioners, and physicians. They really came together to ensure that this evacuation was safe and effective to make all of our patients comfortable.
And this was in the darkness of night in the building.
So there were power to some of the units at this point. The stairwells were not well lit. There was no lights there. However, there was volunteers on every floor, as well as ourselves were carrying flashlights down the stairs in order to make it safe to get down the stairs with the babies.
Have you ever trained for something like this?
We did have an evacuation last year with Hurricane Irene, but fortunately in that case we did have elevators. So this was a new experience for all of us, but I have to say we came together really nicely.
I understand the word circled around the hospital quickly that the backup generator was getting close.
We actually were so focused on patient care at that point that there was no way for us to sort of ascertain what was going on in the rest of the hospital. We were making all measures to ensure that even if we didn't have power, that the babies would be safely taken care of. So we were just really focused on getting the patients safe in the hospital, and then once we learned we were evacuating, getting the patients out safely.
How about the patients that weren't babies that were moved? How nervous were they? What were they saying? How were they handling it?
I was really impressed not only by the NYU staff but by the NYU patients, and these were all patients that we had made the determination that weren't sick and they were sick enough that they needed to maintain in the hospital. So these patients were being evacuated in med sleds, which is sort of like a little canoe that you put the patient into and strap them in. And as I was walking up and down the stairs, patients were smiling at me and thanking me. It really, people came together and made the patients comfortable and were carrying the patients down the stairs.
Kind of renews your faith in the human spirit, doesn't it?
I was beyond impressed with all of my coworkers. It was a night that I felt just so very proud of nursing as well as the profession of medicine in general, that they were able to come together and accomplish this enormous feat and do it in a very safe way.
And the sick baby. Tell us about that.
So I carried down an infant with a physician. The physician carried the baby, and these babies were not able to breathe on their own. They had a breathing tube in their throat. So I secured the breathing tube in their throat as well as provided manual breaths using what's called an ambu bag. It allows us to give air and oxygen into the baby's lungs. So the two of us walked in unison down the stairs with me leaning on Dr. Saguna Narasimhulu's shoulders, and he...
And how many floors are we talking?
We're talking 15 floors. 15 floors with the two of us.
That's amazing. It's absolutely amazing. You have done your profession in your life. Very proud.
Thank you.
The country needs to hear this story. Congratulations.
Thank you.
Lori, thanks so much for joining us tonight.
Thank you for having me.
And a programming note, tomorrow night at 8 p.m., the networks of NBC will air Hurricane Sandy Coming Together, a benefit concert and telethon to aid the victims of the storm. The event will be hosted by Matt Lauer and headlined by New Jersey natives Bruce Springsteen and John Bon Jovi, and Billy Joel of Long Island also going to be involved. Money raised from the telethon will benefit the American Red Cross, and certainly we hope you will tune in, and we will be back with you on this broadcast tomorrow night at 11 o'clock Eastern Time.